Hello everyone, I'm Dr. Haddad and I'm going to talk to you about masks today. This is a surgical mask and this is a respirator. If you look at range of masks, there's a homemade mask, the surgical, the respirator, and the half face and full face, so we're not going to talk about these two ends. Surgical mask, that comes in 3 levels, level 1, 2, and 3, which is low, medium, and maximum barriers. The respirator is known as an N95 here in North America, or FPP2 and 3 in Europe and the UK. Now, is there a difference between these two masks? If we look at the 4 F's of mask selection, the first two, the filtration and fluid resistance, which is protection from air and fluid, is the same. What they differ in features and fit, and that's what makes the N95 a more superior mask. Now, how effective are wearing masks as opposed to no mask wearing? There was a study done in Australia, it's a small study, but they looked at these people who were around people infected with the flu virus, and it showed, if you look at this, it showed that not wearing a mask has a 17% effectivity rate. But wearing either mask will give you protection, so it's much more effective to have a mask than not wearing a mask. But what's interesting is that the surgical mask and the N95 give you almost the same protection. So how do we put this on? You must remember the color is always on the outside and the folds are on the outside. This is always white on the inside. So when it's clean, you can touch it anywhere. You put it over your nose, around the ears, and make sure you squeeze on it that way. Now, to take it out, use the elastics, just the elastics. Don't touch the mask, and you discard it. Now, it's very important because I see people in public wearing this, and they wear it around there, and they keep touching it. They touch the groceries, and then they touch their mask. Well, that's not effective whatsoever. So you must remember, if you clean your hands, wear your mask, and then take it out, clean your hands. Do not touch the mask. That's really important. Do not touch the mask. For the public, if you want to wear masks. Now, for the N95, it's a slightly different way to put it on. You put that with the loops down, put it around your face, then the top, and then the bottom, that you squeeze on that. And then that's, to take it out, you take the bottom first, you take the top one out, and then you discard it. Now, it's this is originally made as a disposable, but we are looking at different ways, and there are different studies are being done to show the difference between, to show how effective the mask is. And if you look at this study, the effectiveness of a new mask and a mask used for 11 days is almost the same. So it stays effective. The question is how to sanitize it. And one way of doing it would be using a UV light, or you can have a few masks and then rotate them every 3 days, because after 3 days the virus is not present. Now, without the rest of the gear, the mask is not effective. So for providers, you must wear the mask, glasses, shield, a cap, and long sleeve barriers. That's what we do here at Skyview when we are treating emergency patients for now. What happens in the future, we don't know. So I hope that was helpful. Stay healthy and stay safe.